I'd like to welcome everybody to today's webinar, Paramedic Emergency Skills Program, a collaborative interprofessional project by midwives, physicians, and paramedics. This webinar will discuss an exciting new educational program for paramedics developed by the Association of Ontario Midwives. The Paramedic Emergency Skills Program was developed specifically for paramedics in response to a new medical directive from the Ontario-based hospital group medical directors. The Paramedic Emergency Skills Program, I'll refer to it as the PESP, draws largely from the AOM's long-standing evidence-based emergency skills workshop program and reflects paramedics' scope of practice in out-of-hospital birth management. This webinar will showcase how midwives are contributing to the training of paramedics in emergency childbirth skills across Ontario this year. My name's Annabelle Cope. I'm a registered midwife and content developer at the AOM. I was also a midwife co-lead with Shirley Bourgeois on the Paramedic Emergency Skills Program, and will be leading our presentation today along with Shirley. Before I begin, I'll just briefly go over a few of the webinar functions. The phone lines are muted to avoid disruptive background noise. During the webinar, you can type in your questions into the questions box, which you should see on your screen. Your questions are confidential. None of the participants will be able to see the question or know who asked it. Please feel free to type your questions throughout the presentation, though we will hold off on reading questions until the end of the slide presentation. I'd also like to remind everyone we're recording today's webinar and archiving it on the AOM members only website. We know that many midwives watch webinars together, and the AOM supports group learning opportunities. There may be emergency room docs on the line today, paramedics, medical directors, other interested parties, and you may be in groups. We'd like to accurately capture the webinar attendance, so please take a moment to answer the poll as it appears on your screen. Your response is confidential, and this will only take a few moments of your time. So in addition to myself, we have 3 other speakers for today's webinar who acted as project leads for the PESP. I'd like to introduce Shirley Bourgeois, Dr. Eric Hannell, and Scott Gorslin to you today. Shirley is the Director of Clinical and Professional Development at the AOM. She's a registered midwife and acted as a midwife lead for the PESP. Dr. Eric Hannell is an emergency room physician at St. Joseph's Healthcare Centre in Hamilton and Associate Medical Director for the paramedics at the Hamilton Health Sciences Centre. Dr. Hannell took on the role of physician consult for the development of the PESP. Scott Gorslin is the Manager of Paramedic Practice at the Sunnybrook Centre for Pre-Hospital Medicine in Toronto and is the lead paramedic educator for the PESP. Thank you all for joining us today. In today's webinar, Shirley and I will provide some background on what led to the partnership between the AOM, the Ontario-based hospital group, and paramedics, leading to the development, rollout, and delivery of the Paramedic Emergency Skills Program by midwives. After this brief introduction, we'll turn the presentation over to our guests and collaborators, Dr. Hannell, Scott Gorslin, and Shirley, for a Q&A. We also will attempt to answer any questions you may have about their involvement in the project, working with the AOM and midwife instructors, perhaps on-the-ground interactions between midwives and paramedics with the rollout of the PESP, as well as any questions about the new medical directives for paramedics regarding emergency childbirth management at a hospital.
So this is Shirley speaking, and I'm going to tell you a little bit about the history of the program and the history of the relationship between midwives and paramedics. So some of our midwife members joining us on the webinar today might have been involved in the paramedic ESW developed by the AOM in 2013 and 14. These workshops were initiated by the AOM and focused on providing continuing education in childbirth, but more so it was to promote midwifery as a profession, including scope of care, skills and knowledge, and collaboration with paramedics in managing out-of-hospital emergencies. In 2014 and 15, the AOM was asked to provide comments and feedback to the Ontario-based hospital group and the Ministry of Health regarding changes to the BLS and ALS standards, for which, for the first time, introduced childbirth as a delegated act with various life support saving procedures that evolved into the Advanced Life Support Patient Care Standards. So if you're asking what the Ontario-based hospital group is, they go by the acronym OBAG, and it's a group made up of representatives from all of the 8 Ontario-based hospitals, which are the regional hospitals that organize and supervise paramedics. The Ontario-based hospitals include the Central East Pre-Hospital Care Program in Oshawa, Health Sciences North Centre for Pre-Hospital Care in Sudbury, Orange Air in Sudbury, Southwest Ontario Regional Base Hospital Program in London, the Hamilton Health Sciences Centre in Stony Creek, the Northwest Regional Base Hospital in Thunder Bay, Regional Paramedic Program for Eastern Ontario in Ottawa, and Sunnybrook Centre for Pre-Hospital Medicine in Toronto. So as you can see, some of these hospitals cover a very large geographic area. So although the paramedics are associated with a specific base hospital, they could in reality be working hundreds of kilometers away. So each base hospital has a governing executive and regional medical directors working with a team of associate medical directors. All are emergency room physicians working and certified in emergency medicine in Ontario. Eric, who's with us today, is an associate medical director for the Hamilton Health Sciences Centre and a full-time emergency room physician. Because childbirth has moved into the Advanced Life Support Patient Care skills and is now recognized as a delegated act, paramedics are expected to carry out certain skills and maneuvers under the authority and liability of the base hospital physicians. So to provide context, this means that there are approximately 36 medical directors, or EMS physicians, who are responsible for the ongoing competency and acts of approximately 9,000 paramedics in Ontario. So given this history, the Ontario-based hospital group recognized 2 things. That first, the out-of-hospital environment is unique compared to clinical and hospital settings. And number 2, that midwives are the experts of attending childbirth out of hospital and the professionals most likely to interact and collaborate with paramedics in pre-hospital settings. So OBEG approached the AOM in the summer of 2015 to explore the idea of the AOM developing an emergency childbirth skills program for paramedics.
So throughout 2016, the AOM, with our OBAG and paramedic partners, drafted and created the Paramedic Emergency Skills Program. The work was created by midwives and staff at the AOM, drawn largely from the AOM's ESW, and adapted to reflect the paramedics' expanded scope of practice, their work environment, and to meet the identified learning objectives and medical directive from the OBAG for paramedics. The Paramedic Emergency Skills Program is centered on providing safe and competent care to patients experiencing emergency childbirth situations out of hospital. As we know, emergency childbirth management requires knowledge and skill for obstetrical assessment, patient and equipment setup for delivery, and a grounded understanding of normal uncomplicated childbirth. With these tools, paramedics will be well placed to effectively identify complications of labor or birth, use clinical judgment to provide timely transport, and provide competent and confident care when out of hospital. The PESP includes a comprehensive manual, an instructor training handbook, an 8-hour hands-on training day with instructing stools at the stations, and a self-assessment test for all participants, as well as a quality assurance program. Key chapters in the PESP include patient assessment, patient prep for birth, and equipment setup. And then the key curriculum chapters are uncomplicated childbirth, including precipitous birth, nuchal cord management, delivery of the placenta, postpartum care for patient newborn. There's also information about denied or hidden pregnancies and other at-risk populations with limited prenatal care. Shoulder dystocia is a comprehensive chapter, and McRoberts and suprapubic pressure are 2 maneuvers that have been added into the scope for paramedics. Key for breech birth is Morso Smelly Veep maneuver is a new addition for paramedics. There's information and skills for paramedics to manage twin birth and multiple gestation out of hospital, as well as malpresentation and cord prolapse. Paramedics now have the skills and training to identify cord prolapse and manage it by manual digital elevation of the fetal presenting part. Postpartum hemorrhage is a new chapter where paramedics are being trained to safely deliver placentas that are ready to be delivered and to perform external uterine massage. There's information on complications and special considerations as well in this training around preterm labor and birth, preeclampsia, slow to progress labors with OP babies or in primates, and meconium-stated amniotic fluid. The PESP rollout began in January of this year by training paramedic educators at the Sunnybrook Base Hospital, which Scott, who's here today, is a part of. And he's shown in this picture experiencing his training in this photograph with one of our midwife instructors. Over the course of this year, midwife instructors will train all paramedic educators. There's about 244 of them across the province at the base hospitals. And then over the course of the year, these educators will in turn train their 9,000 paramedic colleagues across the province.
So one of the biggest things that we had to think about and deal with was really addressing paramedic scope within the program, so which is different from midwife scope. So this table that you see in front of you highlights the key differences in paramedic scope of the practice from midwives differences between the paramedic and the midwife scope of practice, and it helps midwife instructors teach the emergency skills management to paramedics that actually reflect the paramedic scope. So while midwives are self-regulated primary healthcare providers who typically hold privileges at one or more hospitals in their communities, paramedics work under medical delegation or direction from an approved base hospital physician or medical directors. So what that means is that paramedics cannot take directions from physicians or midwives on the scene. When midwives are on the scene with a laboring, birthing, or postpartum client, paramedics will work according to a standard that exists called the Regulated Health Professional Standard, and may be asked to assist to the level of their certification or as they're authorized within their scope of practice. One of the biggest things that you'll note is that paramedics do not perform vaginal exams and they do not listen to the fetal heart rate. So the one exception would be the manual elevation of the presenting part in the case of a cord prolapse. Other than that, you can notice also that there are some maneuvers specific to shoulder dystocia and breech, which are not within the paramedic scope of practice, and the PESP reflects that within the curriculum. Another one which I think most midwives know is that paramedics are not carrying oxytocin or any medications to deal with postpartum hemorrhage, and so a lot of emphasis has been put on safe delivery of the placenta, the external bimanual compression, and also external uterine massage once the placenta is delivered.
We thought we'd show you a sample of the paramedic instructor's skill station sheets. We call them cheat sheets at the station, that are available during the 8-hour PESP training day, and it's available at the hands-on role-playing station. So each of the curriculums has a double-sided cheat sheet like this to identify all the key areas that the paramedics are learning. So this one's for uncomplicated childbirth with a focus on precipitous birth. So a lot of the curriculum has involved knowing the mechanisms of labor and birth, how to discern if the delivery is imminent or not, if there's time to transport, or if you're going to have to prepare that patient and set up your equipment for delivery. And also crowning and birth and a nuchal cord management. And then we get to the other side of the sheet is the third stage of labor, how to safely deliver the placenta, what are the signs of placental separation, the immediate postpartum care for the birthing patient and the newborn. So what we have here is a picture of a whole bunch of medical directors at their annual general meeting in Niagara in February. And it was a pretty fantastic day. The medical directors participated in the 8-hour training day for the PESP as designed for paramedics. And they signed off at the end on the emergency childbirth medical directive and integrated some pretty integral feedback into the directive that was all agreed upon during that day.
Look how much fun that one medical director's having. In the upper left slide, I have to make a comment there. Yeah. You can tell he's really enjoying the whole experience.
He liked the twins component. That's right. Okay. So now we're going to turn it over to you with your questions, and we have some questions here for our guests. Please feel free to type in anything that you have to ask. And this next section is just going to be free flow. So maybe Shirley will start.
Sure. Mm-hmm. So we've prepared some, well, you guys at home and on the computer have questions. I invite you to please write them in now. And in the meantime, I have some questions prepared that I'd like to ask Scott and Eric to be able to reflect on. So can I ask you guys, what was the push behind the emergency childbirth medical directive moving childbirth into the advanced life support, and how did this begin?
I'll let Scott start. I think he was involved before I got involved in some of this.
It's a good question. So in 2014, the Ministry of Health began an in-depth review and revisions of all the paramedic clinical practice or the patient care standards. So that involved the BLS patient care standards and the advanced life support patient care standards. It was during that time that it was identified that management of emergency childbirth by paramedics is under the Controlled Medical Acts, and therefore had to be moved from the BLS patient care standards, which had no physician oversight, into the advanced life support patient care standards. And that really began the whole development and involvement with the Ministry of Health and the base hospitals with the Association of Midwives.
That's great. So what influenced the decision of the medical directors to approach midwives and the AOM to develop this out-of-hospital training program for paramedics?
Sure. I think some of it, I mean, whenever new content or new education is prepared for paramedics, first the base hospitals look at it themselves and see, is this something we can prepare? Because they prepare quite a bit of education themselves. But they also look at outside kind of resources. And in this case, we looked at the obvious sources, like the Canadian College of Family Physicians, the obstetrical groups, and of course the midwifery groups as well. And it just is a natural fit that completely made sense, considering most of your deliveries are out of hospital. You're fully trained and skilled to manage the emergency kind of situation out there, and you're already educating your midwives in those emergency skills already. So it was a natural progression just to kind of modify, kind of adapt the course into the paramedic world. And another point would be, it's a great kind of collaborative approach in the sense that who is a paramedic going to interact with most if they're delivering a baby in the field? It's hopefully going to be a midwife in the best situation, and we want to make sure they can kind of prepare as a team and work together as a team in education.
That's great. Can you tell us a little bit about what that interprofessional collaboration has been like for both of you?
Yeah, so speaking from the educator perspective and frontline paramedic, the whole process has been very well received from paramedic educators and frontline paramedics. And one of the biggest achievements that I think that we've seen is the real understanding and value placed on both professions, both from the AOM instructors when they come in to speak to our paramedic educators, and also the feedback from the paramedic educators, truly getting a sense of what our midwife colleagues are doing in the same environment. So that's been a big learning point and a very big success in the collaboration process from the educator perspective.
Yeah, from the physician perspective, and I was really happy to work with midwives again, because I should make it known, kind of my first delivery as a third-year medical student was under the direction of a midwife. So I worked with midwives as a medical student, as a resident, and as a practicing physician. So very happy to work with midwives again, so fully supported the idea of midwives being kind of the collaborators in this case. And yeah, it's been great from the beginning. I remember looking at the first kind of ESW kind of skill course, and I was very collaborative in the sense I could look at that and kind of fit the skills into kind of paramedic skills as they kind of were at the time. and kind of transfer those skills over in a way that made sense, kind of without making a million medical directives and a million procedures. Because I know when you guys first came through, you have all this knowledge you want to give to the paramedics, rightly so. We had to kind of figure out how to fit it in without overwhelming our education with, double the amount of directives it has already.
Mm-hmm. So, and what's the feedback been like from paramedic instructors and participants regarding the program itself?
So to date, we've trained approximately 300 frontline paramedics within the GTA area, and thus far paramedics have really enjoyed the education that they're receiving on it. In general, the comments that they're providing the educators with are the style of the course, the way it's set up with repetitive practice on clinical procedures, and objective feedback given from their peers to discuss how to manage it, as well as the manual that they all receive that provides that background information. That's been the biggest comment. But in the end, everyone leaves the session feeling much more comfortable with their abilities to manage that type of clinical situation. So we continue to monitor the feedback, but so far it's been very, very positive.
Yeah, that's great to hear. And Eric, what did the medical directors or physicians taking the program that we see here in the pictures, what was their feedback from a few weeks ago at their AGM?
I mean, it was very positive. You have a group that varies dramatically. Some physicians might be delivering babies on a regular basis, and some may be not doing so much, or having a fully supportive ER where they're having obstetrics come down right away for their deliveries. So there's a lot of apprehension before the course started in terms of how much do I have to review? Am I going to be kind of under the watchful eye of my peers, and is it going to be a stressful event? And I reassured everyone from the beginning it would be very welcoming. You'd have a lot of opportunity to build up on the hands-on component from kind of an uncomplicated, in quotes, simple delivery to something more kind of catastrophic and potentially dangerous. So everyone can kind of naturally flow into it. And I think that's what everybody appreciated after the day. They really liked that. And that kind of speaks to how we deliver a lot of our education. Whenever we can, we try and put in as much simulation, as much hands-on as possible. Because when you get these kind of uncommon but potentially high-risk events, practicing rather than just talking about it is always the best way. And that fit with the prior ESW course you had. So it was nice to kind of do that in this day. And I know our physicians loved it. I mean, if you look at all those pictures, I think everyone has a smile on their face. They're all having fun. There's lots of humor in the room, lots of storytelling and examples and lots of hands-on practice. It was great.
That's great. And then where do you guys see this collaboration work going between midwives and paramedics, or midwives and emergency room physicians?
Yeah, I think it's going to be an ongoing kind of interaction. I mean, this is just a start to kind of bring the paramedicine and midwifery worlds together, per se, in education. And things like this webinar, we do very similar things, with our education system, because, now we've delivered the training, you're still the out-of-hospital experts, and we still kind of need access to you outside of just interacting in the field. And I know for sure questions will come to me that I'm going to have to ask you about, and things like these webinars or kind of ongoing education through either bulletins or whatever form that takes is going to be kind of the future. Another consideration is going to be, besides base hospital educating certified paramedics, you've got colleges educating kind of paramedic students, and they're looking now as to how are we going to develop our curriculum, who are we going to go to, where do we get our resources, and I'd like to think we'd be able to facilitate kind of that interaction with your group and the colleges to kind of build a solid base.
That's great.
So just to add to Eric's comment, I think in the end, the collaboration and relationships between paramedics and midwives is ultimately going to lead to an increased positive patient experience and improved patient care in that out-of-hospital environment. Having an understanding of each of our abilities and clinical practice will go a long way to improve that care.
Yeah, definitely.
That's great. And we have a couple questions from folks on the line, so I'll just ask this. So somebody asked, in an emergency situation, for example, a home birth, can a paramedic be directed or asked by a midwife to administer oxytocin by a midwife? Is that within the scope of a paramedic to provide an injection?
No, and Eric can speak to this more on the delegation component, but the standards are very clear, and paramedics are guided by both the BLS and patient care standards and the ALS patient care standards, which specifies who a paramedic can take delegation from, and it's very clear that it is a base hospital physician. And it's a medication that's outside the scope of a paramedic, so they couldn't administer that medication anyways in that sense.
Okay.
Yeah, that's basically as it would stand now, and that's a similar rule for kind of any interaction with another health professional on the scene. And paramedics have to do this on a regular basis. They'll have a physician on scene, nurse on scene, and it's just a matter of kind of knowing the kind of delegated acts that are out there, and knowing kind of what tools and skill sets each provider has.
But for example, in a situation such as this, a midwife asking a paramedic to say take vitals or something like this, that would be considered appropriate.
Absolutely. I mean, that is something in a paramedic skill set, so it would absolutely be able to do that. That's why things like this webinar and kind of midwives seeing what we're training the paramedics in is important. Because if you kind of turn the situation around, you could imagine, let's take the morbid example, if there was an arrest on scene and the paramedic tried to direct the midwife to defibrillate a patient. That may be very uncomfortable for a midwife who may not want to take kind of that instruction from the paramedic because it's something they're not familiar with. So it's, in a sense, a very similar thing in terms of what your kind of scope and your expertise is.
That's great for clarity.
Yeah, so the paramedic will work under the regulated healthcare profession standard, which does direct the paramedic to assist in a collaborative care of that patient up to their level of authorized certification. So things like vital signs and even advanced delegated procedures, if the patient requires an intravenous,
for example, an
IV fluid bolus, if that's within their authorized scope of practice, and there are different levels of paramedics in the field, the paramedic will understand and will know their authorized scope of practice, and they can perform those procedures as per the ALS patient care standards and collaboratively care for that patient.
That's great. It's very clear. Thank you for that. A question more specifically about the course. It says, somebody writes, there's a post-course self-evaluation required within 30 days of the completion of the course. What are the consequences for paramedics who are not completing it? That's administered, so from what I understand, the post-evaluation of the self-assessment is administered at each base hospital for the instructors, and then the instructors, that is a necessary component in order for them to complete the program to be able to train paramedics. Is that correct?
That's correct. Yeah, the self-reflection or self-assessment is specific to the paramedic educators from the base hospitals who will be going out to instruct frontline paramedics. So for them to maintain kind of their authorizations to teach that course, they have to complete that to be qualified.
Right, and that's being administered at each base hospital site independently, like each one is administering their own.
Yeah.
Okay. And then there is a question here which says, is there a role for registered midwives to support paramedic trainers during ongoing training sessions? And I know that one thing that we did talk about was that in different areas as the trainers are being trained, that it would be very nice to be able to just even invite midwives to come and have lunch on the training days to be able to sit down together to create some of that interprofessional collaboration. So along with their paramedic and midwife instructors. To get together. So that's something that we are working on, to be able to communicate that to folks within local areas who would be interested in making that connection.
Yeah, I think that's a great idea. We do similar things in terms of, say, a doc sitting in on a particular course to help out in that expertise. I can think of an example in kind of our area with Six Nations. We have quite an active midwife group there, and I'd love to hear from members of that group, and if they want to help out, in collaboration with the AOM at the day.
And that is happening. Those conversations are already happening, so they're going to be attending the training for the Six Nations.
That's the exact kind of stuff we were hoping for with this, to kind of bring the two worlds together more and more.
So, and then a question from online is, do you anticipate the paramedic scope of practice will increase? For example, performing an episiotomy or administering oxytocin in the future?
It's a great question. So in terms of paramedic scope changing, it definitely will change. It's always changing, and that's kind of the challenge of bringing in new directives like this, because every year levels of care, standards of care, but standards again in quotes, can change, and we have to update and make sure we train paramedics on that. And there's only so much you can do within a year, so it's hard to train them on everything. And the other thing I find we have to bridge a lot in terms of the EMS world is kind of providing the care that's important at that time, because we've all been in that situation about making the decision to stay on scene and resuscitate versus getting back to hospital and getting to an ER or something like that. And that's where paramedic skill set really shines, because they are kind of almost the experts on deciding when it's kind of time to go and get out of the situation they're in. So whenever we look at new skills, we always kind of bridge it in terms of how much value is it pre-hospital versus in-hospital. So that's the stuff we consider when we look at things like new medications or new skills, and that'll be stuff we'll be talking about in the future in collaboration with you guys again.
That's great. So just as we come to a close, there has been a few questions from folks online about whether the recording will be available to non-members, and so I can say that I can look at that from our point of view and see if we can get it up on the public side of our site for folks to be able to access. So I will take that on to figure that out. And then just in closing, was there anything else that you guys wanted to add or that you felt you didn't get the chance to share as we come to a close? Not to put you on the spot.
No, I would like to thank the AOM for collaborating with the Ontario-based hospital group, and when I had my time with the MOH, the level of resources that you were there for was absolutely amazing, and I look forward to continued works in the future.
Yeah, I'd like to echo that. I think the AOM's been great in terms of kind of trying to understand the paramedic world and understanding kind of how we fit in terms of kind of government regulations and kind of Healthcare Act regulations. I think that's been great, and that speaks to the success. It's nice to see kind of what feels like 2 years of work summarized in 6 slides on the webinar. Great. I needed to see that before I did some of my presentations. It would have been helpful. But yeah, no, it's been a great process, and I look forward to it continuing.
Yeah, it certainly has been a great process and a great experience from our point of view as well. The collaboration has been very, it's been really exciting. So, so up until now we've had 300, I'm just responding to one last question.
Sure.
And that is that somebody's asking, are there still paramedic educators awaiting training? So there are lots of paramedic educators awaiting training, and that's happening in different parts of the province. That will be happening through the course of the year up until likely fall.
So Sunnybrook has completed our training of our educators. We've put through 53 paramedic educators. And I believe other base hospitals are beginning today. But the paramedic training will take place from now right up until early December.
Yeah, CPER kind of in the Hamilton Health Sciences District has started today.
That's great. So any ESW instructors who are interested in becoming instructors for the PESP, they can be in touch with Annabelle for details, and I believe that brings our webinar to a close. Thank you so much for joining us.
Thank you, Shirley. Thank you, Scott and Eric, for joining us today, sharing your experience with developing such a unique and I'd say historic program for paramedics. And thank you to everyone on the line for attending today's webinar. Just a reminder, we will be sending out an evaluation shortly and would really appreciate your feedback about the webinar. In close, spring is here, and with it brings new learning opportunities with the AOM. Our next live event, Healthy Practice Culture, will be taking place on March 31st in Markham. We also have an abundance of webinars coming up. On March 28th, we have our CAM Global Projects webinar, followed by a student conference showcase webinar, cabergoline and developing a protocol for lactation suppression, which will be on March 29th. In April, we have 3 great webinars, starting with instrument sterilization on April 11th and our disability and midwifery 2-part series on April 13th and 19th. Have a great afternoon, and we will look forward to your participation in an upcoming event or webinar. Thank you.